audience members out there, thank you for joining in to this episode of Now What? I am Tiffany Jeminet. I come to you from Lafayette, Louisiana. I'm born and raised in Louisiana all my life and have been in the public health sector for the last 20 years. I've built this Now What series based on this quote. Everything that was sent to break you was actually waking you up to your own light. You're going to shine brighter than ever before. And this is a quote I got from the universe, according to the internet. And this is something that I definitely felt and have lived regarding my public health time in Louisiana. And I am blessed that along the way, I've been able to pick up some really cool friends. And I have a great network that consists of amazing people like Dr. Earl Nupsius Benjamin, who we will call Nupsius on this call. So, Nupsius, could you give us a brief introduction for our audience?
Thank you, Tiffany. First, I want to say thank you so much for having me here, but also for creating this thing that's happening with Now What? I think we are at a pivotal time in our society where things like this are being created by people who have done the work. I think for a long time, we have people who are not necessarily connected to community, telling people what to do, but it's really exciting to see you, who I've known for some time now, who has been in the trenches of public health, doing something like this and just being that thought leader that you've always been. So I greatly appreciate that.
Thank
So
you.
for your audience, I am Earl Nupsius Benjamin-Robinson. I am a doctor of health science. I'm a board certified public health practitioner. And recently, I became a fellow of the National Academy of Practice. And so I am now FNAP. And so I'm very excited about that. I'll be inducted in Indianapolis this March. So that's very exciting. But to tell you a little bit more about me, I, like Tiffany, am, because we probably started at the same time, am like a
Mhm.
20-year public health professional who has worked in the areas of HIV, who has worked in the areas of tobacco prevention and control and cancer most recently, who has worked with community, worked in the areas of community engagement and health equity and social determinants of health. My last position was with the Louisiana Cancer Research Center as the director of their Office of Community Engagement. That also encompassed a position of the Louisiana Campaign for Tobacco-Free Living when I was the senior director of that. And so I've had a long career in public health. And I think the thing that I'm most, no, though you didn't ask this, but I think the thing that I'm most proud of is, and I see it in you as well, is that our commitment to community, our commitment to people, our commitment to making certain that people get what it is that they need to achieve the best health that they can achieve.
Thank you for that. Everything you said, your intro, and then how we go back, is really important. And you captured exactly what I am trying to do with this Now What series. I feel like we're at an opportunity where we need to take some leadership of the narrative.
Mhm.
There's a lot out there about public health practitioners and our public health field. And it's important that we, as practitioners who have been in the trenches, tell our story. So, this is all around getting stories out, especially, you know, those stories that are inspirational, like yours. So the quote I mentioned, I wanted to check in with you. It talks about things that were sent to break you is actually waking you up to your own light. So what are some things or a thing or two that you feel like tried to break you but only made you stronger?
Yeah, good question. I've been thinking about this. Some time ago, I was at a conference, and I was at this conference with my partner, and there were some individuals that I know, and they knew me, and I could see the the disdain that they had on their faces because I am a same gender loving man, and I have due to I believe to my ancestors, to my parents, I have done a lot of great things in my life, and I think so when these individuals saw me, I think there was an expectation of how dare you be who you are and still be winning.
Mm,
And so that's something that, given the society that we live in, that's something that I've had to deal with all of my life. And so the people's attitudes about me are their ideas that are negative in relationship to me. That's what I think about given the statement that you've asked. And I use that to be my motivation. And I was recently listening to Oprah the other day, and she was reminding a young lady that the ancestors have already paid the price for you.
mm.
They've already done the work. They've already bled the blood. They've given their lives, and so just live and do what it is that you need to do to be the best person that you can be. And so that's something that I love the quote that you start us with, and in relationship to that quote. That reminded me of what Oprah reminded a young lady that, the debt has been paid for you. Go out there and make things happen. So, a great way to start our conversation today.
For sure. Thank you for sharing that quote. And thinking about the ancestors, definitely important because now is our time to win. Like,
Yeah.
what better time?
Hmm.
And so I don't know about you, but 2025 has been hard for me
Yes. Hmm.
and, a lot of our community members for sure.
Hmm.
And it seems like we're always pivoting. My mission, I would say, is always to pivot on the right side, or always
Yeah.
to pivot with good energy to keep it
Yeah.
positive, right? And so after this global crisis with the pandemic, now we're going through, a national crisis with, policies being changed that doesn't protect community members as much as we think they should.
Hmm.
There seems to be a lot of dismantling within public health. So, share with us a little bit about how you've had to pivot this year. What does pivoting mean to you? So, what's your now what story?
So my now what story is probably in January of last year. Leadership at the Louisiana Cancer Research Center, who had came in like 2.5 years earlier, announced that they were leaving and taking a position at a research institution in California. And so this person had created the position that I held inside the organization. And so I
Mm,
knew that given that transition and also given what we see happening presently inside at the federal level, that there were going to need to be some changes that were needed to be made in my professional life. And so I started making some decisions about where I wanted to be and what I wanted to do. And I started interviewing. And I probably got a position, two positions, in fact, in the middle of the summer, but was not able to take two offers, in fact, but was not able to take either of them because dealing with a family member's health, and I didn't want it just wasn't a good time. And so
mhm,
I later got another position, and I decided to leave my position inside the Louisiana Cancer Research Center, and haven't looked back ever since. I did decide because I really wanted to be certain about what my next position was, and so the position that I had taken before I left the Cancer Center was supposed to start October the 22nd of this year.
mm,
Probably like a week and a half before I was supposed to start, I went ahead and called the organization and let them know that this was I do apologize, but I'm not going to be able to accept this position because I really I turned 50 in August, and so that's another thing that happened this year. I turned 50, and I just wanted to live a very purposeful life, and I
absolutely.
want to live in a way where I am able to do what it is that I want to do. And I want that to be in alignment with the work that I'm doing and the people that I work with. And so those are a couple of things that have happened, that have the pivots that I've made this year. So I'm in the process of making some decisions about where I want to be next. But presently, I am teaching at Xavier University.
Mhm.
Loving that. I love providing information, education, and empowering students at Xavier University. And I have my own boutique public health firm called the BACH Group. And BACH stands for Behavior and Community Health. And so we have had contracts with HRSA, CDC, presently in health departments. We presently have a contract with the Mississippi Department of Health to provide a training to their community health workers, getting them certified as health coaches. And then we also have, at the present moment, we're doing a trauma series, and we're talking about on every month, we're bringing experts to the table, and we're having discussions and providing information about subject matters that intersect with trauma. And so this started in October. And so our first conversation about trauma, the intersection was religious trauma. And then last month, in November, it was, excuse me, in December, it was um, uh, what was it? We just had it. Oh, chronic illness and trauma, and how those two things intersect. In January, we'll be doing a session on adverse childhood experiences, or ACEs,
Mhm.
as they're known. And what that's going to be focused on is youth. And trauma. And then in February, we're going to focus on LGBTQ health and trauma. And then at that time, we're going to do another level breakout of trauma
Mhm.
sessions month to month, because trauma has a relationship with everything, and so we need to be very, very mindful, help to build people's capacity to do that work.
For sure. Um, so addressing trauma feels like your manifestation of how you're trying to be or you are a healer in this world. What I've learned is a lot of our colleagues in public health, like at our core, we
Hmm.
want to do the healing work. We're doing the healing work as part of who we are, what we were
Yeah,
born here to do. And
yeah.
so, hearing that, I know that whoever's tapping into your sessions are getting in a little bit of healing from y'all.
Yeah, I hadn't even thought about that,
Yeah,
Tiffany. Yeah, I mean,
for
yeah,
sure.
that's a great way to look at that. Yeah,
Yeah,
we are doing that, and I never really thought of myself in that way, but I accept that and I receive that. So I greatly appreciate you providing me a framing of how I should look at my work. Greatly appreciate that.
absolutely. And we can definitely talk more offline about that because that's kind of what the retreat I'm planning in April, that
Hmm.
it's
Hmm.
based in us being healers. So.
Yeah.
Let's talk a little bit about what you see between being an academic professor and then the actual practice, like public health practice and being a practitioner. Um, a lot of our work is in community, like
Mm.
getting communities trust in public health right now, right? Because there has been a breakdown
Yeah.
since the pandemic. So share a little bit about how you think we can rebuild the trust in the community, or what should we be doing?
I think we should really be, good question first. I
Hmm.
think that we should really be looking at how we are engaged with community, how we are in relationship with community. I think that there is indeed a disconnect, and we want to go to community and say, we've looked at the data, this is what you need. And so we are giving the community a tremendous amount of information, and and oftentimes unintentionally, we are speaking at community versus talking to or working with community. And
Hmm.
so for me, I think that there's a need for us, and this isn't rocket science, we've known this for years. There's really a need for us to be very intentional in how we are engaging with community. I follow community engagement continuum that CDC has established, and also the International Association for Public Participation utilizes. And I think there's a need for us to really, when we look at that community engagement continuum, looking at, what kind of outreach activities are we participating in, are creating for community? How are we consulting with community? How are we being involved with community? And that involvement has to be bi-directional, give and take,
Hmm.
reciprocity.
Hmm.
How are we collaborating with community? And I think the most important part, and this is the part of the continuum that really you're really doing it when you're doing this. How are you sharing leadership with community?
Hmm.
Again, as I stated earlier, we far too often unintentionally go to community because we think we know best, and we just give them a whole bunch of information, do this and do that, but we are not really in relationship with them to the point where there is shared leadership, where we and community are working together. We're trying to solve the problems together. We're looking at the resources and making decisions about the resources that we need to help deal with this situation. So for me, it's about really following the community engagement continuum, outreach, consultation with community, involvement with community, collaboration with community, and shared leadership with community.
Absolutely. With the changes at the federal level, one thing that I see in working with other public health organizations is that health is local. I
Hmm.
almost feel like there's a shift or the need for a shift as we rebuild the public health sector, that we really figure out how to do a better job of, embracing the local aspects of our work. So what are your thoughts about that statement, health is local?
That's like politics is local, health is local. I think that under this shared leadership umbrella, there are things that we need to be doing that will help us to be in alignment with ensuring that we are paying attention and understand the dynamics of health being local. So I think one we need to move from community input to shared governance, where we are working with community at a local level to one, building their understanding to know what's going on, and working with them to take ownership and us coming up with solutions
Mhm.
for what is happening. Since the public health is local, I think two, there needs to be a shift around budgets to match the rhetoric where we say, where we're using pay, resources, and staff in shared leadership, where individuals inside community understand what the funding is and what the funding is being spent on, and they too have a part to play in helping make decisions about what those resources need to be and
Mhm.
how those resources need to be spent. Um, I think there need to be some trust measures and enforceable that are enforceable that help us to track how we are in relationship with community. I think this is one of the key things that's needed since public health is local. We need to be tracking how we are responding to community
Mhm.
when they have concerns. We need to be tracking how the percentage of decisions made with community, being able to communicate that to them. We need to be tracking how funds are controlled by community, what percentage of the funds are controlled by them to help us navigate these processes. We need to be uptaking satisfaction by the subgroups, speaking to people, doing focus groups, having conversation with them, asking them, is what we are planning, is it something that you see as beneficial? Do you feel as if your voice is being heard? Um, and we need to be trying to resolve complaints and harms. So I think for me, since we understand, as particularly you and I, having been in the trenches, we understand that the health is local. But we also, to build better relationship with community, we need to be focused on not a checkbox dynamic,
Hmm.
but more, measuring how we are in relationship with community so that we are holding ourselves accountable. So I think that there is a need to make trust measurable and enforceable inside the community, particularly since public health, health inside communities is local. So for me, I would say overall that there's a need for us to start measuring how we are in relationship with community. And I think that will hold us accountable.
For sure, for sure. Let's talk a little bit about your experience and I guess what you learned about our community, specifically the African American community, while you were working at the health department during
Mhm.
COVID, during the pandemic.
Oh, yeah.
So I'm sure, this was a topic of many conversations around the African American community's distrust of public health, the government, the vaccine. And there was a lot of strategies that were put out to help protect African Americans during the pandemic because of health disparity. So, um, how would you, what could you share with the audience about what you learned and just the idea of the distrust and rebuilding trust with the African American community?
I think the first thing I would have to say is that the distrust or the hesitancy that we see inside the African American community when it comes to healthcare, when it comes to science, when it comes to research, that distrust has been earned.
Mhm.
That hesitation has been earned. We have treated people certain ways. We have contributed to and exacerbated people's health outcomes. Some of it was very intentional, and then later some of it became unintentional. But it's not that something that I tell my students is the health inequities that you see happening inside community, they're not natural. They're not natural at all. They
Mhm.
are a result of policy decisions, prioritizations. They are a report of the result of power plays. And so African Americans and their hesitancy around COVID was as a result of what had happened to African Americans and what does happen to African Americans and particularly when it comes to their engagement with the healthcare system. And so
Mhm.
there was a tremendous amount of vaccine hesitancy because harm had been done. And to try to, and I also, having been in it, saw that people were like, well, the house is on fire. We need to do something. And we're telling them the truth, and they're not listening. Well, you can't, for 100, 450 years, treat someone this way or only give someone misinformation. I mean, only give them misinformation or not give them the resources to make the decisions to be the healthiest that they can be. And then on today, look, the house is on fire. I'm telling you the truth. I promise you, I'm telling you the truth. Look,
Mhm.
there are Black people who helped to develop this, and so we're telling the truth. And so anyone, you're just not going to be able to do that overnight. And so to answer your question, there was a tremendous amount of vaccine hesitancy. There was a tremendous amount, and that was due to what had happened and what does happen to people inside the healthcare system. Even today, we see that in one area that we see it in, because there are multiple areas that we see it in, but we see it inside the maternal child health outcomes for African American women. And so, again, as I stated earlier, these health inequities, these health disparities, they are not a natural phenomenon. There is something
Mhm.
in the environment that's contributing to that. And people, as a result of being human beings, we are observing, we're watching the patterns. And so, as a result of watching those patterns, we have learned to be hesitant and to distrust. We learned to be hesitant and distrust. And so the other thing that I learned was The thing that helped people to go from less hesitancy, because for some of them, you're just not going to be able to eliminate all of the hesitancy,
Right.
but the things that help people to reduce the amount of hesitancy to the point where they were getting vaccinated was others inside their families talking about the fact that I got vaccinated. People having conversations, their family members, their peers, people
Hmm.
inside their churches. And so you saw
Hmm.
at the beginning where it was just information getting out. We were just getting information out. But you saw in the middle, we started transitioning messages that spoke about what their peers were doing, what their family members were doing to protect themselves. And there was a tremendous amount of encouragement for people to share their experiences with their family members. Um, and so I think that played a key role in African Americans getting vaccinated more and more and more, having those conversations with their peers and their peers letting them know, look, I got vaccinated and I'm okay. When I got COVID, I didn't get as sick and I didn't die from it because we do know the facts are, if you take the vaccine, it definitely decreases the likelihood of death and of severe illness. The
Yeah.
other thing I think that was important is that what I saw was the messages that were very clear, concise, and crisp were the messages that were received well. When you were trying to give too much information, where people were like, and it was, and you were using language that was big, and you were just using because sometimes I think in public health we give too much information. We just need to
Hmm.
go to one, two, three. This is what's happened. Um, I think that, the more crisp that we got and succinct we got at getting messages to some of the most vulnerable communities, the more we saw hesitancy go down and we saw more vaccinations taking place, particularly inside the African American community.
Yeah. It feels like when we like take time to be intentional and like really think about what's needed, we know that the messages should be that way, right?
Yeah. Hmm.
I think it
Hmm.
just, it's a wake up call to just be really intentional about who we're talking to, what information is needed, how much is needed. So thank you for sharing those lessons for
I
sure.
also think I think it's important. One thing I saw was because in going in communities and sharing information with people, when people are talking about their hesitancy, you can't just shut that down. You have to listen to that because the moment you just shut that down, they're going to shut you down.
Yes, we
And
have
so
to
you have to
listen.
acknowledge, yes, those things
Yeah,
happened. Yes, those things were horrible. I am, I'm sorry, but this is the information that we have today. These are the facts.
yeah.
This. And people are surviving COVID. They're not getting as sick, and no one is dying as a result of the vaccine. And so,
Yeah. Well, I think you share and have a wealth of knowledge for our public health community as we regather and get together to figure out what's our path forward. Specifically, again, as a lot of our federal infrastructure is changing. So the community, the state is definitely relying on leaders like you, Dr. Benjamin Robinson, to create the future. And I'm here for it to observe and witness
leaders like
leaders like
us.
us. Thank you. And I know you're in the middle of, identifying your next role, but one thing I absolutely am certain of is that you're going to have community as your priority and community engagement. So thank you for that work. Um, any final messages for our public health colleagues, specifically who are listening? Any inspirational words for the next year?
Um, do what makes you feel good and what aligns with you. And when people understand that when people are emotionally invested in believing a certain thing about you, there's nothing that you can do to change that. And
Mm.
so focus on you and focus on being in a place, being in positions where you are heard and you are seen. And so I would say that focus on finding those things that make you happy and that bring you peace.
Yes, to all that. In order for us to heal, we have to be healed, right? And we
Hmm.
can't pour from an empty cup, like they say.
You
So
cannot. You
if we're
cannot.
good, our community is going to be good because
Hmm.
that's our priority, is to take care of
Mhm.
others. So thank you, sir, for this great discussion. I look forward to many more. But this was just a little taste of Dr. Benjamin Robinson for our Now What series. Thank
I look
you
forward to coming back again and being on it.
for sure.